This is CGTN, China Global Television Network.
Africa sees more than 7,000 coronavirus cases confirmed across the continent. Spain records fewer COVID-19 deaths for a second day as the United Kingdom reports a surge in fatalities. And Lassa fever epidemic in Nigeria far deadlier than COVID-19. Hello and a very warm welcome to Africa Live here on CGTN. From Nairobi, I'm Mahia Mutua. Here's what else is coming up. Also in this bulletin, we look at how Ugandans are being encouraged to use online medical services. And DR Congo residents warned against rush for herbs believed to cure COVID-19. Well, now, China has marked a national day of mourning to remember those who lost their lives to COVID-19, especially those who died while trying to save others. At 10 a.m. this morning, local time, people across the nation observed 3 minutes of remembrance. National flags were also lowered to half-mast. The event marked the first national day of mourning for a public health incident and the fourth overall in 70 years. In Wuhan, where the outbreak began, a memorial was also held to mourn those who have died from COVID-19. The death toll in the capital of Hubei is at least 2,500 people and accounts for more than 75% of the country's fatalities. Our reporter Shu Mongqi is there.
A moment of silence dedicated to the memory of those who lost their lives fighting the novel coronavirus.
Because of the contagious nature of the coronavirus, funeral traditions around the world have been cut short or abandoned. Today on Qingming Festival, however, nationwide mourning is finally giving many Chinese people the much-needed chance to honor the dead and grieve their loss.
In Wuhan, the epicenter of China's coronavirus outbreak, the death toll, according to officials, reached 2,567 as of April the 3rd. Those who lost their own battles with the virus while fighting the epidemic at their posts have been honored as martyrs.
I feel really bad because many of those who sacrificed their lives during the outbreak were still quite young. I'm here to pay my respects and offer a silent tribute.
Among the ceremony's attendees are family members of the deceased, delegates of medical professionals, the police, community workers, volunteers, as well as government officials. And while mourning the dead, different groups have also expressed their determination to carry on the fight.
I think it is more about inheriting their unfinished will, to work harder and fulfill our duties in guarding and caring for the residents. We have a few remaining medical teams in the designated hospitals tackling the thorny treatment of critically ill patients. Many are still in dangerous condition, so we need to continue our efforts and relieve them of their sufferings.
On Saturday morning, life in the city was also brought to a halt as people stood in silence to pay tribute. Shu Mongqi, CGTN, Wuhan.
Well, let's now take a look at the latest figures on the COVID-19 pandemic. The number of confirmed cases globally has now surpassed 1.1 million. Over 60,000 people have died from the disease. With over 278,000 confirmed cases, the United States has more than double any other country. It reported more than 32,000 new cases in the past 24 hours. More than half of all COVID-19 cases are in Europe, with Spain and Italy the worst affected. Iran is the hardest hit in the Middle East, with over 55,000 infected. The Chinese mainland reported 19 new infections on Friday. All but one were imported cases. Well, staying in Europe, where Spain has reported a downward trend in fatalities for a second day. Over 11,000 people have died from the coronavirus in the country. the second highest in the world behind the United States. A state of emergency will be extended there for another 2 weeks. France has seen a significant rise in infections after data from nursing homes was included. It has more than 82,000 cases. Meanwhile, the United Kingdom has reported 708 new deaths, a fourth successive daily high, bringing its overall tally to more than 4,300. The country has recorded nearly 42,000 infections in total. In Africa, the number of COVID-19 infections are gradually rising. There are now over 7,000 confirmed cases of the coronavirus across the continent. Here in Kenya, the government has confirmed 4 new cases of the coronavirus. The patients include 3 Kenyans and a Pakistani national. This brings the total number of COVID-19 cases to 126. Let's now get the latest figures showing the spread of the coronavirus across the continent. Most countries on the continent have shut down their borders, closed schools, and banned public gatherings in a move to curb the spread of the coronavirus. Some have even gone into full or partial lockdowns. Let's take a look at the numbers by region on the continent. In North Africa, Morocco has recorded 67 new cases of COVID-19, bringing the total number of cases to 858. Algeria still has the highest number of coronavirus cases. Egypt follows closely, while Sudan maintains the lowest tally. Meanwhile, West Africa has recorded 19 new cases. The Senegalese government has announced an additional 12 new COVID-19 cases, bringing the total number of cases to 219. Togo has also reported 1 new coronavirus case. The Malian government, meanwhile, has announced 2 new COVID-19 cases. Liberia has 3 new COVID-19 patients, while Cabo Verde has 1 new patient. Burkina Faso still has the most reported cases in the West African region. Elsewhere in Central Africa, the Chadian government has confirmed 1 new COVID-19 case, bringing the total number of cases in the country to 9. Cameroon has the most confirmed cases with 509. The DRC, which continues to deal with the Ebola epidemic, has the second highest number of recorded cases in the region. On to Eastern Africa now, where the region continues to report the lowest number of confirmed cases. Kenya has 4 new confirmed cases, bringing the total number of cases in the country to 126, the highest in the region. Djibouti has 1 new case, while Ethiopia has confirmed a total of 3 new cases. Governments are, however, taking necessary measures to stop the spread of COVID-19. And to the south of the continent, Mauritius has confirmed 10 new COVID-19 cases. This brings the total number of cases in the country to 196. Malawi also announced a new case of coronavirus, lifting the total number of cases in the country to 4. South Africa continues to record the highest number of cases. The government has enforced a 21-day lockdown, as well as carrying out a mass screening campaign in an effort to stop the spread of the pandemic. Now, African governments have agreed to jointly push for loan waivers. The move aims to cushion the continent from the adverse effects of the coronavirus pandemic. The decision was reached during a virtual meeting of the Bureau of African Union heads of state and government. The leaders said foreign debt is a common challenge for all African countries. They also noted that Africa needs an economic stimulus package since the slowdown in economic activities brought by the coronavirus outbreak will cost the continent jobs and affect incomes of vulnerable populations. The leaders further called for collaboration between international partners and the private sector in rolling out mitigation measures. Healthcare providers in Uganda are encouraging patients to use online medical services while under lockdown. Uganda is enforcing a partial lockdown to contain the spread of COVID-19, and access to health services is increasingly becoming a challenge for some people. CGTN's Hilary Ayesiga now reports.
High heels are one of the major problems.
Arun Dige, a doctor with Ruby Medical Center, is attending to a client. He's using video conferencing technology.
People should take more advantage of this, and as it is a free consultation, they can come up, they can talk to us, they can talk to doctors, and they can take the free advice. And if at all, if it is complicated, obviously we are going to call them, or they can visit great hospitals near them.
Using this technology, patients can consult on health issues. Rhoda Nakato, an expectant mother, is upbeat about the service.
This is very nice because with the COVID cases, you don't know who you're going to touch, you don't know who you're going to meet, you don't know the roadblocks on the road. So this is very easier. They've made our work very beautiful. For anyone who is sick, all you have to do is get your MBs, log on to the hospital website, make a video conference.
Doctors here say they attend to over 20 patients daily, and the numbers are steadily going up because of the lockdown. Health providers believe the technology is also helping to stop self-diagnosis during the lockdown.
One of the challenges that people have now, especially in this lockdown, is resorting to self-medication. And with that, you may get an overdose, you may get the wrong medication, you may get complications that you don't need. So it's important to have a doctor's opinion.
Then you got the lab people.
After the online diagnosis, the doctor prescribes drugs that patients can then physically purchase. But like any other service, this one also has limitations. Not many people in Uganda can afford internet services, and public transport has been banned. The government is now issuing permits for those in need of medical treatment. And as the country struggles to contain the spread of coronavirus, it's hoped that technologies like video conferencing will play a big role in improving access to health services. Hilary Isga, CGTN, Kampala, Uganda.
Now, the fear of contracting the coronavirus has led many people in the Democratic Republic of Congo to rush for herbs that are believed to cure the disease. Herbalists and traditional healers have been recommending the herbs to the public, but medical experts have dismissed the claims and urged people to seek treatment from health professionals. CGTN's Chris Ochamringa now reports.
The search for traditional herbs for treating symptoms of COVID-19 heats up on the outskirts of Kinshasa. The disease has presented a money-making opportunity for some locals here. These leaves and stems are believed to cure fever and cough. Many Congolese in remote parts of the country have been using them to treat ailments for decades. Herbalists attest to their efficacy.
This plant called Inongo can treat the coronavirus. It has very strong medicinal properties. I believe people who use it can get healed very quickly. It could help save humanity.
The demand for traditional herbs has surged in Kinshasa following the outbreak of the coronavirus. This herb, known as Congo Bololo, is highly sought after by people who want to boost their immunity. But last month, 3 children are reported to have died in Kinshasa after drinking a mixture of the herbal remedy. The head of DRC's coronavirus response team has warned the public against using such herbs to treat symptoms of COVID-19.
There's currently no vaccine or antiviral drug for treating COVID-19. We are using chloroquine and other drugs recommended by international health experts. People shouldn't use those herbs which haven't been scientifically tested.
That has, however, not dissuaded some Congolese from using the traditional medicine.
I'm testifying about the healing properties of this herb. My mother had 16 children. She treated all of us with a mixture of this herb whenever we had a fever, cough, or malaria. And we got cured. I'll continue using it to treat such illnesses.
Most of the COVID-19 cases have been reported in Kinshasa. The government has imposed a 2-week lockdown in one of the busy municipalities to stop the spread of the disease. Health officials only hope the population will heed the call to regularly wash their hands and keep a safe distance. Chris Ochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
Well, it's time for us to take a short break here on Africa Live. Here's what's coming up when we return. Lassa fever epidemic in Nigeria far deadlier than COVID-19. And Zimbabwe's government encourages the youth to join the country's agricultural sector.
You're watching breaking news on CGTN.
Welcome back. This is Africa Live. Now, as Nigeria battles COVID-19, the country is also tackling an outbreak of Lassa fever. The death toll from Lassa fever has reached 185, with at least 12 people dying of the virus in the last week. CGTN's Deji Badmus has more on this story.
While attention is focused on the COVID-19 pandemic in Nigeria, the country's Center for Disease Control is reminding everyone of one virus no one seems to be talking about at the moment, Lassa fever. Despite the high death toll, the NCDC says the fatality rate is actually dropping. It had been 19.5% since the beginning of the year, but the current fatality rate is 5.3%. And the number of cases too is going down, with just 19 cases reported for this week compared to 28 the previous week. Now, the majority of states in the country have been affected, with two southern states, Ondo and Edo, accounting for the highest number of cases. Experts say rodents are the primary source of transmitting the disease.
During the dry season, there is a heightened outbreaks, and we gave some reasons for that. One of them is the fact that the bushes are dried, and then of course people used to put fire for clearing the bush, thus exposing those rodents. So the rodents, once exposed, they will now move inwardly. And then during this dry season, that's when we have most of the farm harvest. So the rodents will follow. So it's the population of the rodents that are becoming higher in the human environment.
Now, health authorities here expect the figures will drop further once the rainy season fully begins. But some health experts have also said there may be a huge decline going forward because of the precautionary measures adopted by many in this country to avoid contracting COVID-19. Deji Badmus, CGTN, Lagos, Nigeria.
Now, a lack of information and limited access to land are among the challenges young Zimbabweans face when trying to enter the agricultural field. The government, however, is looking to help more young people join the field. Mahia Mutua tells us more.
As an agro-based economy, farming is seen as Zimbabwe's future. Yet those expected to shape it say they are being deprived of opportunities.
Yes, I would be interested in farming as a career. That is, if I'm given the opportunity. I think as young people, we do not know much about farming, especially for those who grew up in towns. We do not know so many things about farming.
Food production has recently been in a slump, largely due to erratic weather, but also because of a flight of productive labor.
Young people from the rural areas think that they are missing out on opportunities in the capital city, so they end up flocking here, yet there is no employment. And when they all come here, then there is no one left to work the land in the rural areas.
Zimbabwe is battling to debunk the stereotype that a life in the fields is for the elderly and rural.
One way to make farming more attractive and to increase opportunities for youth participation is to make use of new technology, which will also ramp up production.
The government is trying to capacitate young people.
What we see to be the way out for young people is the right training. You will know that we have vocational training centers within the Ministry of Youth. We have training centers within the Ministry of Agriculture. I think that's where we need to start, to train our young people so that they are entrepreneurs in the agriculture field.
That should hopefully lead to more young farmers and a self-sufficient Zimbabwe. Mahia Mutua, CGTN, Harare, Zimbabwe.
Now, the number of COVID-19 cases in South Africa is increasing by the day. Health experts are worried that the pandemic will hit the country hard, as it already has the highest number of people living with HIV in the world. They are worried about the impact the disease will have on people with HIV or TB. According to the Academy for Science of South Africa, people living with HIV and who don't use ARVs are 8 times more likely to end up in hospital with flu than others. CGTN's Yolisan Jamela tells us more.
South African authorities are moving with speed to contain the spread of the coronavirus. The country is also grappling with the burden of having the highest number of people living with HIV globally. South Africa has over 7 million people living with HIV, and over 2 million of those are on antiretroviral medication. Those living with HIV have compromised immune systems, and UNAIDS has concerns.
Well, as UNAIDS globally, of course, we're concerned about the pandemic itself and its impact on people, on health systems, and also on the economic consequences. But in particular, because of our mandate as UNAIDS, we're concerned about its impact on people that are living with HIV/AIDS. And they're extremely vulnerable in several respects, and COVID-19 is likely to affect them.
UNAIDS is the main advocate for accelerated, comprehensive and coordinated global action on the HIV and AIDS pandemic.
I think our concern is that they continue to have access to treatment, those that are getting treatment, and that more people are brought to access medication. As it is right now, we are watching this very closely, but there is no really evidence that has been documented of co-infection between HIV/AIDS and COVID-19.
There's a strong belief amongst other medical experts that the experience that South Africa has had over many years in tackling HIV means the country may be better prepared to fight the coronavirus, particularly at community level.
I think there are several lessons. One is one that you just mentioned, that over time, in our work with HIV/AIDS, we learned the importance of working with communities to make sure that they manage and monitor and ensure that those affected get the help they need and the support they need, including social, psychological support from families and communities and all.
Medical experts have also cautioned that HIV-positive people and those with TB who are not on treatment will likely be at higher risk of worse outcomes if they do contract the coronavirus. Yolisa Njomela for CGTN in Johannesburg, South Africa.
And here's what we have for you in the sport. All Africa motocross events for 2020 postponed.